And the first question will be, in your design process, how do you balance natural beauty with the expression of individual characteristics, ensuring that each patient can satisfactorily see their unique beauty?
I believe that this is a very important question nowadays because at this age in time, people are talking about natural beauty.
Yes, natural.
And people want to look like themselves, just a better version of themselves.
Yes.
So with our older type of injection techniques or different older type of injection where we have a fixed formula, everybody walking to the clinic, they will receive an injection here,
yes.
here, a very fixed type. Then you create a very template face, it's made in a factory. The face is made in factory, everybody the same, very high cheeks and all that. And that kind of injection technique just doesn't fit into different ethnicity. In Malaysia, we have different ethnicity. We have Indian, we have Chinese, we have the Malays, and of course we have different Caucasian as well. So all of them actually have different facial features.
Yes.
If we use one single type of technique to inject, some will turn out good, some will turn out bad.
It's
right?
true.
So we 3D, I believe that we are able to see the whole image, and it depends on our judgment, 我们自己的审美观，
对
right? Doctor's judgment and also patient feedback as well. So patient can look at their face and they can also see which area that they want to improve more, and we can pre-design to them to show that, okay, with filler I can create this face. Do you like it?
Yes.
Because sometimes things that I like might not be what the patient like.
Yes.
Ultimately, it's what the patient is seeing. So when we design, if the patient say, oh no, I think it's too pointy. I want something, more subtle. Yeah, then we can adjust, and from there, we understand what the patient wants, and then we can tailor our injection according to what we have agreed on using, the 3D image.
Yes. Yeah. Okay. Yes. Thank you. So the second question is, what are the common facial contour issues among Asians?
Facial common contour issue among Asians.
Yes.
I would say that we actually have 4 contour issues.
Yes.
Okay. Number 1 is the anterior cheek 这一边 ，okay, this area.
脸颊，对吧？
脸颊是这边是脸颊吗？
对，这个
anterior
是
cheek
脸颊，脸颊。
So for Asian, especially the Chinese Asian, Korean Asian, and Japanese Asian, our facial features are a little bit flat.
平的，对，我们的面部比较扁平一些，对。
So 比较扁平呢，眼袋也比较就是比较明显。那看下去也是比较累。A bit tired looking, 没有神。
是。
So this is one area that I believe HA filler would help. Alright. Second area is the temples. 这一边。So temples, 太阳穴。
对。
Temples will make someone look aged, tired, weak, and malnourished. 不够营养，不够吃。就你看
疲态。
对，
叫疲态。
So 这一部位。Then third is actually the nose. 鼻子，因为Asian nose are flat, right? Most of us have a flatter nose. And fourth is 我们的下巴。Yeah. So but this area, if we are able to highlight this area for Asian face,
yes.
Then we can achieve a more aesthetic pleasing look ultimately. Yeah.
Okay, thank you. So the third question will be how to avoid a puffy face, creating advanced beauty.
So how to avoid puffy face? I think I mentioned in my lecture just now that number 1 is we need to use the right product.
Yes.
Right? Because we know that some product absorb more water compared to others. And we also need to understand that product that lasts very long may not be the best, right? Because there are studies to show that after, the puffiness can come many years after, ，right？It's not to say that today 我今天打了，我1年过后没有肿就是没有肿，因为4年过后、8年过后，其实那个肿胀会来的。We call it the post-hyaluronic acid edema。所以 if HA filler that lasts for 1 year or so and then you need to touch up, I think that's perfect. If a HA filler that lasts for 2 years, 3 years, I would say please don't use them.
Right. So that product is not perfect.
It's not perfect, yes, because HA supposed to go away, right?
Yeah,
so this is number 1. Number 2 is our injection technique. So try not to over inject, especially giving too much at one area, bolus, right? Try to spread the hyaluronic acid filler out. Try to use combination, so do not over rely on hyaluronic acid alone to correct certain facial features.
Yes.
That will all reduce the risk of puffiness.
Okay, so thank you. So the last question will be, based on your personal experience, what functions of the 3D skin analyzer do you find very useful and helpful?
So I think that's the major content of my talk today, which is to convince patient. Right? Because as a doctor, I believe that most of us have our own judgment. We can judge clinically, what we want to do. We do not need a machine to tell us how much filler to put in.
Yes.
Right? We do not need that. I believe we experience, our hands, our judgment is better than machine. However, to win patient hearts and to let the patient believe in you in the first place, to let you do a procedure, you need to show them.
Yeah.
So I believe that that's the biggest advantage, of using the 3D scan.
Yes， 就是说，在术前的话，我们其实可以借助设备的力量去说服我们的患者，让他们放下担心，然后和他们一起探讨合适的方案。这样的话，我们就可以更好的为我们的顾客做出来更好的方案，对不对？
对 ，exactly， 对。
现场我们大家有没有一些特别想了解的问题？因为我们现场好。
就是3D 方面和整形方面的一些应用，我想再了解一点，就是在皮肤科你会做哪些探索，或者是帮助会比较大一些？
在皮肤科呢，OK， 为什么我会使用这个D9 为什么呢？是因为它不是只是有这个 aesthetic function， 它也是有 skin analyzer。And 在市面上有 skin analyzer 又可以做到 3D analysis 的，应该不多，应该我也没有看到几台，所以我觉得这一个是一个 added advantage skin analyzer。那我用多的是在于 sensitive skin， 因为求美者对吗 ？aesthetic goers right？ 所以求美者呢，他们服用很多。这个 cream skincare， 他们服用很多，冒牌的也有，就刚才你所说的这个有技术的，有 steroid 的，也是很多。
是的，技术的。
对 ，using steroid for very long， 他们会有一些个容易敏感，就是晒到太阳啊，或者紧张啊，会容易敏感，就好像有这个我们说 rosacea-like skin。好像这个玫瑰痤疮，对，玫瑰痤疮的一个皮肤，所以我觉得这一个的话是很好，因为为什么？很多时候顾客不会跟你说，哎，我的脸很容易红，就可能他接受了，他都说哦，这个是我的脸的情况，他就不会跟你说。但你一用这个 3D 的时候，然后你用那个 sensitive skin， 你就看到哦，整个红的，你就跟他说，你是不是有这个问题？那他们会看着你说，哇，医生，你为什么会知道的？So yeah, so I like 那个 sensitive part。如果你说 UV 那些呢，因为我本身在clinic 我们都有用这个 UV lighting， 我们本身都有检查。那我不晓得是一个很 added advantage，but 我觉得可以给顾客看到他们的这个皮肤和 因为以前是我给眼睛看到，现在我可以 share 给我顾客看到，那个是其实也是很大的一个 benefit。
对。
谢谢。